Hi, and welcome to the Healthy Built Environment for Health Professionals training series. We are very excited to have Claire Graham here today to present her presentation titled Policy Advocacy. What is that? And go ahead, Claire.
Thanks. I'm happy to present on this topic. When we start to look at health promotion, which is really the whole field of healthy built environment, we need a different set of tools than we frequently use in our organizations. And so I wanted to walk through some of the background and the tools of policy and advocacy and explore them in a little bit more detail. A lot of this comes back from 1986 when our public health professionals back then came up with the brilliant Ottawa Charter for Health Promotion. And they recognized that in order to build healthy public policy, we needed to strengthen community action usually through our not-for-profits and community organizations, develop personal skills, create supportive environments, and that's a strong piece of our healthy built environment work. Reorient health services, not so much in this particular area, but the circle there in the middle is to enable, mediate, and advocate. And it's all towards building healthy public policy, making the healthy choice the easy choice. And really we know that healthcare accounts for about 25% of what keeps us well. And 15% is our biology. And yet usually those are the two things people think of first when they think of staying well is, oh, I've got really good genes, so I'm going to live long. But really the rest, the 60%, is where and how we live, work, learn, and play. And sometimes people have said that your postal code can matter as much as your care card number in terms of keeping you well. And the way that plays out is through areas like the ones on the screen when we talk about social justice, health services policy, education, and so on. There's a whole range of things that determine our health. And so when we look at health promotion, it really falls outside of, much of it falls outside of our own organization, and we have to work with others. And it's through the collaboration with other partners that we can really make a difference. And so there's this continuum of responsibility of saying, oh, well, food, that's not a responsibility of the healthcare system, or the healthcare system is totally responsible for all aspects of food. And clearly this is a false and ridiculous dichotomy. The reality is that for health promotion, we really have to work with partners and find somewhere in between where we find the areas that will have the biggest impact, and we have the necessary information and resources. So what is policy? Policy often throws people off because they think of it as something very formal and outside, and sometimes it's that. But it's really, healthy public policy in particular is characterized by an explicit concern for health and equity in all areas of policy, and by an accountability for health impact. So the main aim of healthy public policy is to create a supportive environment to enable people to lead healthy lives. And when we're talking about policy, we're really talking about a way of addressing issues so we don't have to keep solving them each time again and again. And so a very quick example of this is if there is a garden shed in a community garden and there isn't a policy for where to keep the keys, everybody that comes that needs in needs to find a key. Once you develop a policy and you know that it's always kept by the gate in the locked box, then you have solved that and people don't need to solve it every time on their own. And there's a lot of types of policy. In many forms, from establishing a mandate or vision, like a community, an official community plan, setting strategic directions and outcomes, smoking rules, bylaws, zoning, or And program or services is another one, or very functional policies. And while most of the ones that we work in the healthy built environment are the high-level ones, such as official community plans, neighborhood rezonings, that kind of thing, the devil's in the details. So sometimes we have to pay attention to some of the more specific type policies as they are developed. So what's advocacy? So strategies, actions, and solutions proposed to influence decision-making on a particular issue or cause. So it's really what we do when we want change and don't have legislation or formal responsibility or even the resources to do it. Population health advocacy is directed at actions to improve the overall health of a population and to address the determinants. And like policies, there's a whole range of types, from self-advocacy and natural advocacy, peer service program, and cause advocacy. And as individuals, we tend to do a lot of self-advocacy or natural advocacy, where we speak up when we've witnessed injustice. As an organization, we tend to get more peer advocacy. Increasingly, our organizations hire or work with peer advocates. Service advocacy, which is making sure people have access to the right programs and services. And program advocacy is making sure those programs exist or that new ones get started. But a lot of the work that we're doing is really around cause or issue advocacy. And there's a couple of principles when we're talking about that kind of advocacy. That it needs to be nonpartisan, regardless of the government in power and how long they've been there. We have to make sure that we are addressing all parties. It needs to adhere to our professional standards, it needs to focus on the health impact, and it needs to be evidence-based. The population health team at Vancouver Coastal Health put together an advocacy toolkit for staff interested in undertaking population health advocacy, and you can find that on our website, the Vancouver Coastal Health Population Health. Look for the advocacy toolkit. And this diagram kind of captures the bulk of the decision making in terms of when to take action and what actions to take. And it starts with issue identification. And is the issue and the desired outcomes clearly defined? Does the issue affect the population significantly? Like, does it really matter? And do you have a process for verifying the issue with stakeholders? It's not enough for us to think there's a problem. We need to make sure that the people affected also see it the same way and that we are working with them. Once you've got the issue identified, do we have the organizational mandate? Does this issue have a clear health implication? Is the issue part of the Vancouver Coastal Health mandate or your organization mandate? Is there an existing organizational position on the issue? And does the issue align with your day-to-day work? So we need to make sure that when we're advocating as a health authority, but as professionals from within our own knowledge base and not on another topic. There's practical considerations too, such as, do we have the expertise to address the issue? Is the organization supportive of that advocacy activities? And do you have the time in your position to dedicate to it? And can you identify the internal and external resources that are available to support your work? While many advocacy strategies have started with a single person, they are never successful with a single person. They always have to build in other people and organizations that support it. So once you have the issue, you've decided you want to move forward, there's a number of options for considering what action, what's the best way forward, implementing that action and doing the evaluation and follow-up. There's a lot of different kinds of advocacy strategies once you're moving ahead from simply being at decision-making tables and being able to have your input as issues arise, There's scheduling topic-specific meetings with decision makers. They're supporting other partners. Very often we're not the lead on some of the advocacy work going on. There's the media advocacy, letters to the editor and so on, and other social media, flash mobs. There's no end of creative ways of getting your point heard and encouraging others to agree with you and take action. So this is a very quick presentation to just touch on a couple of those core issues of policy and advocacy. And if you've got any questions, you've got my email there and you can send me a question. Thank you very much.